This video will cover iron deficiency, which may lead to disorders of marrow production. To help us remember this video is about iron and iron deficiency, we'll use this gym full of iron. Next, iron deficiency can lead to microcytic and hypochromic anemia. To help us remember microcytic, we'll use this TV that's set at a very convenient channel that sounds a lot like MCV. And the low volume will remind us of low MCV. To represent low MCHC for hypochromia, we have our character who, don't you agree with me, he's trying to be all macho and intimidating here? The word macho shortened can get us to MCHC. And since this guy is short, we'll remember low MCHC. The earliest finding in these patients is a decrease in serum ferritin. This is represented by the bat trying to get to that empty tin can. The bat represents blood because bats are blood-sucking, right? And the empty tin can represents low ferritin because doesn't tin can sound like ferritin? And since ferritin is a protein in blood, we can tie the bat to the tin can. The next finding we'll talk about is transferrin saturation, which in these patients is expected to be low. This is represented by this trampoline here, which sounds like transferrin. But you see how it's got what looks to be like some static electricity? Static sounds like saturation, and that's how we'll remember that one. Oh man, looks like this guy's too old to use the trampoline because it's only for kids under 10 years old. This represents the transferrin saturation in these patients, which is expected to be less than 10% and therefore low. Next, let's move on to this shark that looks kind of scary, and he's being displayed elevated like a trophy. Did you know that shark in Spanish is tiburon? And since the first three letters of tiburon are tib, this elevated shark here will represent elevated TIBC. Any of you know that famous brand of lighters that starts with a Z and ends in what sounds like hippo? Well, looks like this character has got one of those here. This lighter represents ZPP, or the full name, zinc protoporphyrin. If you shorten the brand name of that lighter, it sounds like ZPP, right? And since our guy is holding it and lighting it, we'll remember that ZPP is elevated in these patients. This guy is doing well in his New Year's resolution because it's February and he's still at the gym. The February calendar reminds us of FEP, or free erythrocyte protoporphyrin, which is also elevated in these patients. The short way of writing February is Feb, right? And Feb is so close to FEP, or FEP. Since the calendar is up high on the wall, we'll remember it's elevated. Come on, man, you don't need a pencil that big because you're jacked. I promise you'd be okay with a normal pencil. The pencil represents pencil cells, commonly seen on peripheral blood smear. See that emoji tattoo on our guy's huge biceps? It represents elevated SSTR, or somatostatin receptor, in these patients. STR reminds me of strength, and this guy has got a lot of that. Reaching the end here, you see that mento candy? It's there to help us remember the Menser index, which is simply the ratio of MCV to RBC. An index of greater than 15 is suggestive of iron deficiency, while less than 13 is suggestive of thalassemia. And you see how this pack contains 15 pieces? Conveniently there to remember that these patients will have an index of greater than 15. Last prompt here, we made it. Look at this cool dude over here. He's really giving dude vibes in this image, right? Yeah, this cool dude reminds us of duodenum, where iron is mostly absorbed. Duodenum, of course, sounds like dude.